Do we know yet what the cardiac complications are?
We don't know for sure, but what we do know is that the overall rates of these sorts of cardiac complications are pretty low. So what we really need, unfortunately, even though it is a month and a half or a year and a half in, we still need more research to figure this out.
The percentage numbers are there, and we can all do scientific notation, 10 to the minus whatever. Forget about the math of it. People are going to compare cardiac internal medicine complications to, say, the flu or a cold or pneumonia. Are they equivalent, or is this much worse?
It is worse. It's substantially worse than the flu or the cold. Pneumonia depends on what kind of pneumonia you're talking about, but we can draw the comparisons all we want. This is still a more deadly and a more serious infection by far than just the flu or the cold.
And Dr. Dowdy, this brings up long COVID and what we know in terms of how long COVID lasts, how prevalent these long existing symptoms are. What's the latest on that?
So the prevalence of these symptoms depends on who you compare it to, but it's certainly a real thing, and certainly at least one in 10 to 20 people experience these symptoms beyond 3 months. How long it lasts, we're still figuring that out. The longer you go, the fewer symptoms there are. But it definitely persists, and for some people has persisted as long as we've been tracking their symptoms.
Meanwhile, Dr. Dowdy, it is getting cooler. Kids are back in school for the most part, and they are starting to expose each other to whatever germs they have, despite the best efforts to keep their masks on. Are illnesses that are not COVID more severe because of the 1 year hiatus between getting infected with anything? Are our immune systems down so much that other illnesses can have a more severe impact?
So it's probably not because of the immune system being down, but rather because our immune systems haven't seen these things for a year and a half because we've all been hunkering down. It's possible. We don't know if things like the flu are going to be more serious this year, but it's definitely a possibility, and it's something we're keeping an eye on. It's all the more important to get that flu vaccine this year.
Is Delta fading away? Is the Delta virus fading away? I think it was the India virus before it was the Delta. I can't remember now. But, I look at the maps in the Washington Post, the New York Times, Bloomberg, the wonderful FT work. Great. Can you say we've really rounded the corner?
I think we have rounded the corner. It doesn't mean that there's not another surge in front of us, but cases are definitely going down, and all of those cases are Delta. So I wouldn't say it's fading away. We're still at about 100,000 cases a day, so it's still a big deal. But it is going down, and it looks to be a real trend.
Where are we on masks? I was on Fifth Avenue yesterday, and I noticed for the first time a real dearth of masks out there. There were a lot of people walking around without masks on in a very fully vaccinated New York City as well. Where do you stand on masks, Dr. Dowdy?
Well, I think right now we're still seeing enough transmission that it's still a smart thing to wear masks. It's more important indoors than outdoors. But I think we're still in a place where we need to be keeping those masks on.
Dr. Dowdy, I got to be honest. People are getting sick of COVID. We're kind of done with this, and I'm wondering how long we can have to sort of keep going at some of these same topics again and again at a time when we do have prevalence, but hospitalizations are going down. When can we stop?
Yeah, well, I think I'm sick of it too, but I think that we still have a little ways to go. I do hope that this surge might be the last big surge, and we might be turning that corner. So there's reason to hope that in the next 2 or 3 months we're going to be back down to where things were before. Though no one can ever say for sure. I do think that we're going to be living with this for at some level for many years, but hopefully not at the kind of to where it's going to be making on your news stations all the time.